Dr. Jose Ramón Fernandéz-Peña is here now, board chair with APHA. Thank you for joining me.
Thank you for having me.
So we're talking about immigration as a public health issue. Explain.
Immigrants are fully integrated into the fabric of society, yet oftentimes they do not have access to the services that the rest of us have, concretely the health sector. We have been very intentional at times, especially during this administration, in making sure that immigrants don't have access to health services, to housing, to a number of aspects that enable them to be fully contributing members of society. For example, when a parent has to take time off to take a child to the emergency room, that time the parent is not able to earn the money they need to stay at home, to provide the food to the family, issues of nutrition may come up, the health of the kids may start coming up. So it's imperative that we understand the role that immigrants play in the United States and that we enable them to be fully contributing members of society.
So how do we do that? How do we strengthen the U.S. public health infrastructure to better support the people who are coming into this country?
Part of it is supporting the public health infrastructure, but part of it is also enacting policies, immigration policies that are coherent, that make sense, that not chastise or scapegoat particular groups into particular corners of stereotypes, of negative stereotypes. The health sector, as it is right now, is experiencing shortages in critical areas across the country, especially in rural areas. In areas like mental health, like oral health, the shortages are critical on two levels. We don't have enough workers, and second, we do not have a workforce that looks at all like the population seeking health services. So the lack of cultural and linguistic diversity of the health workforce is in and of itself a barrier to the access of services. So one of the many ways we can do that is realizing, for example, that there are almost 2 million high-skilled immigrants in the United States right now that are either unemployed or underemployed, many of them in the health sector. If we were able to capitalize on this talent and include them into the workforce, not only would we be better able to provide services, but also these individuals fully employed to the level of their training would contribute approximately 39 billion with a B dollars to the tax base of the country. And this is not me, this is the Migration Policy Institute studies putting the information out.
So if we want to improve the opportunities for immigrants, we clearly need to get better. What can we learn from other countries about doing a better job?
It's a mixed bag. Some countries have done very interesting things. Canada always comes to mind in many ways as a country that has really been very effective in integrating its immigrants. So have countries in the European Union like Sweden, even Germany. Australia has also done very good work in integrating immigrants in many ways. But we can learn from what other countries are doing, but we have to adapt those practices into the realities of the United States. I think we need to start by educating the country in general and really dismissing all those tags that are being placed on immigrants, the bad hombre tag, the Muslim terrorist tag, and all these tags that immediately are attached to an individual because they sound different, look different, speak differently, or worship differently. So I think that a public education campaign, which is also an aspect of public health, is where we need to start.
When you talk about the positives of some countries and you talk about some of the negative things that have happened right here, there are also things we can learn about what not to do from other countries.
Correct. And we can get into very heated discussions there, and what we appreciate in the United States as a multicultural society where we welcome and try to integrate individuals in a way that enables them to maintain their cultural, linguistic, religious identities as opposed to homogenizing the entire group into a one size, one flavor only, like in France, for example, which has been very clear that their practices are, I don't know, questionable from the perspective of the United States, perhaps.
It's an ongoing conversation,
it is
for
indeed.
sure, but an important one to begin. Thank you, Doctor.
Yes, it is. Thank you.